Good evening and regards. My name is Dr. Anand. I'll be speaking. Number one, P for pediatrics, P for passion. You need to have a lot of passion, but the problem is P for passion, P for patience. But positivity and patience is there in pediatrics, because in pediatrics, you don't treat the child, you treat the family, you treat the mother. Counseling plays a very important role. So, number one, first question, girl or a boy, who should take pediatrics? Anyone can take pediatrics. It is not gender biased. Second question, will AI will what you called cover pediatrics? So basically, AI will not do anything, because most importantly in pediatrics, you need to counsel the family, and AI don't have a role in that. Third question, work-life balance. Work-life balance, it all depends on you. You can have a very wonderful work-life balance. If you want to earn a lot of money, it's nice. After 9 to 4 job, you can have your evening private clinic, or weekend you can go out peripheries for postings. But otherwise, work life balance is pretty easy in pediatrics. Next, very important, what are the negative points? Positivity, so everyone knows, but what are the negative points of being a pediatrician? Number one, of course, patient counseling sessions are very important. You don't treat the child, you treat the family. Mother has a whole story to tell you. Doctor, मैंने ऐसे किया, मैंने वैसे किया, he got a fever, he got a cough, I grinded this thing, he vomited 3 times, then you know what happened. So she has a whole story to tell you. All you have to do is just listen to her like this, like a story, and she just counsel her basically. And secondly, medical legal cases of course are there in medicine also, it is there in pediatrics also. So you should know how to counsel. Documentation is very tight, has to be there in pediatrics. And as far as the super speciality is concerned, it's not mandatory to do a super speciality in pediatrics. You can very well do MD-Peds and earn really pretty nice. NICU, like the best part about pediatrics is, like for the NICU, neonatal intensive care units, you have 4 or 5 diagnoses, and the whole story revolves around it. So you can earn pretty good amount of money. So it's not that pediatrics is a boring branch, but the only thing it is, you need a lot of patience, because they are really newborn babies. Like this devil is there sitting next to me, so you need to take care of them. So you need to have a very positive attitude, and that's the whole story. And last but not the least, I would rather say that don't run behind money. Paisa kisme zyada hai, paisa kisme zyada hai. That's a wrong question. Where is my passion? Ask yourself, and your first thought is the final thought. So don't run behind money. Don't run behind wanting to get rich. Just be good at your job. Feel what are you good at, and everything will make sense by the end of the journey.